Dr. Selma Holden, thank you for joining us. So you were trained as a conventional family medical doctor. So how did you become interested in the potential therapeutic benefits of ketamine-assisted therapy?
When I was in my family medicine training, I was involved in the treatment of chronic pain and substance use disorders such as opioid use disorder. So I saw a connection with people who are struggling with addictions, to put it in one way, and how there was an underlying current of trauma that people would share in terms of their ability to cope with chronic pain or the cravings of substance use disorder. So I got interested in the harm reduction movement in terms of how to use substances such as buprenorphine or Suboxone to treat opioid use disorder. And in that realm, that's where I became more aware of just psychedelic therapy in general. So the studies from Johns Hopkins looking at cigarette smoking cessation using psilocybin, end of life anxiety, sort of like those like intense fears that people would have when they had a terminal diagnosis given. So I was an integrative family doc even during residency. So I was part of the University of Arizona's integrative medicine residency programs. There was a few pilots of them, 5 programs across the United States. And there was a combination of like, how do you use this therapeutic benefit of an expanded state of consciousness, which could often be achieved through mindfulness-based meditation, yoga, other modalities. But there's this potential effect that could happen with psilocybin, which is sort of the most classically studied one at that time. And what is this intersection about? Like, how does it address trauma? And how can people actually have the resources within themselves to just do a deeper healing modality?